the anatomy of the urinary system. First, we will identify the component of the renal system or urinary system. We have two kidneys, right kidney and the left kidney. We have two ureter, right and left, and urinary bladder, then urethra, in both male and female. If we talk about the kidneys, it is located in the abdominal cavity, and it has correlation with the other organs such as suprarenal gland, and it is supplied by renal artery and renal vein near the ureter, and there is opposite to them the inferior vena cava and the aorta. Downward we have the ureter, which cross the iliac artery and vein, and to reach the urinary bladder. The urinary bladder, it is anterior to the uterus in female, and behind the uterus there is the rectum. The functional unit of the kidney is the nephron. And this picture shows the blood supply of the kidney, which is renal artery and renal vein, and the structure inside the kidney. We have the renal pelvis, which is the space which collect the urine, and we have the medulla, which is the outer surface, the inner surface of the kidney, and we have the cortex, which is the outer surface of the kidney. The nephron is the functional unit of the kidney, which is located in the medulla. Here is some structures inside the kidney which filter the blood and excrete urine. The blood enters the kidney through the renal artery and pass through the glomerulus, then to the medulla through the efferent arteriole, then it goes to the efferent arteriole, pass through proximal convoluted tubule and Bowman capsule, distal convoluted tubule, collecting duct, lobe of Finley, and filter the blood and excrete urine. Function of the urinary system. The urinary system, also called excretory system, is the organ system that produce, store, and eliminate urine. In the human, it includes two kidney, two ureter, the bladder, the urethra, and the two sphincter muscles. Under microscope, it's called morphology. This paired organ weighs about 300 grams, compound for two parts of cortex and medulla. Cortex, mainly we see the glomerular apparatus, and in the medulla consists of 1 million filtrating unit termed nephron. So the nephron is the functional unit of the kidney. The kidney plays a critical role in regulating electrolytes such as sodium, potassium, and calcium, and it clears urea and nitrogen waste as a waste product from the metabolism of the amino acid. Here we can see lateral view. We can see the ureter, and it comes back to the urethra. Here is in the male genital system and outside to the body. In this picture for the female, we can see the urinary bladder anteriorly. Superior and behind the urinary bladder we have the uterus, and behind the uterus we have the rectum. Thank you. If I give you a summary about this lecture, we should concentrate about the component of the urinary system, which is kidney, ureter, urinary bladder, and urethra, the location of the kidney, and what is the other relation, such as superior to the kidney there is suprarenal gland, and what is the blood supply of the kidney, what is the functional unit of the kidney, and what is the function of the urinary system: produce, store, and eliminate urine. The nephron location in the medulla and the glomerular apparatus in the cortex, and in male we have long urethra, and in female the urethra is shorter. Now we will go to the human nervous system. Here we should know the component. First of all, I will compare between the parasympathetic nerves and the sympathetic nerves. The effect of parasympathetic in the eye, it constricts the pupil, and in the sympathetic it dilates the pupil. In the sympathetic may increase by stress. So when becomes stress, your pupil it becomes dilated, and if you are relaxed, pupil should be constricted. About the saliva of the mouth, parasympathetic stimulates saliva, and the sympathetic inhibit the saliva. So when you are stressed, you have dry mouth. Constrict airway in the parasympathetic, and they relax airway. So when you are stressed, your lung bronchus became dilated, and you feel that you can't get out the oxygen from your lung. In the parasympathetic, you will have slow heart rate, and in the sympathetic, the heart rate will become faster. Parasympathetic stimulate the activity of the stomach and the The sympathetic inhibit the activity of the stomach. Parasympathetic inhibit the release of the glucose stimulate gallbladder, and stimulate the sympathetic stimulate the release of the glucose and inhibit gallbladder. Parasympathetic stimulate the activity of the intestine, and sympathetic inhibit the activity of the intestine. So when you have stress, you may have diarrhea because the intestine does not absorb the water. Parasympathetic contract the bladder, and the sympathetic will relax the bladder. So when you are stressed and the bladder is full, the sphincter of the urinary bladder, it will becomes relaxed and you may lose your urine. Nervous system component, we have central nervous system, which is composed of the brain, spinal cord. Here is the brain and here is the spinal cord. Contains relay neuron and composed of the peripheral nervous system composed of cranial nerves, which they are 12 cranial nerves, and spinal nerves, peripheral nerves, and contains sensory and motor neuron. Here is picture of distribution of the nervous system. Thank you. If I will give you a summary about the nervous system, you should know what is sympathetic and what is parasympathetic, and the effect of sympathetic and parasympathetic, and what is the central nervous system and the peripheral nervous system, and component of central and peripheral nervous system. Thank you.